Welcome to This Week in Medicine, your filtered medical journal summary. Looking to stay up to date with the latest medical research but short on time? This Week in Medicine has you covered. Our AI-generated podcast provides you with a convenient, on-the-go solution to keep you informed about the most significant developments in the medicine field. Each episode offers a filtered and concentrated summary of key journal articles, allowing you to stay informed without the need to sift through pages of research papers. With This Week in Medicine, listening is faster than reading, and you can consume valuable medical knowledge while commuting, exercising, or during your daily routine.
Hi, This Week in Medicine, we will be discussing. First, we will be discussing articles in New England Journal of Medicine. Perioperative Durvalumab in gastric and gastroesophageal junction cancer. Background. Perioperative FLOT, fluorouracil, leucovorin, oxaliplatin, and docetaxel, is a standard therapy for resectable gastric and gastroesophageal junction adenocarcinomas, but recurrence rates remain high. Immunotherapy plus chemotherapy may improve outcomes. Conclusions. Perioperative Durvalumab plus FLOT led to significantly better event-free survival outcomes than FLOT alone among participants with resectable gastric or gastroesophageal junction adenocarcinoma. Next article. First-line treatment of pulmonary sarcoidosis with prednisone or methotrexate. Background. Prednisone is currently recommended as the first-line treatment for pulmonary sarcoidosis, but is associated with many side effects. Methotrexate, which is recommended as a second-line treatment, appears to have fewer side effects than prednisone but a slower onset of action. Data are needed on the efficacy and side effect profile of methotrexate as compared with prednisone as first-line treatment for pulmonary sarcoidosis. Conclusions. In patients with pulmonary sarcoidosis, initial treatment with methotrexate was non-inferior to that with prednisone with regard to the change from baseline to week 24 in the percentage of the predicted FVC. Differences in the side effect profile between methotrexate and prednisone may inform shared decision-making by providers and patients about the appropriate treatment approach. Next article. Graft-versus-Host disease prophylaxis with cyclophosphamide and cyclosporin. Background. Allogeneic peripheral blood stem cell transplantation, SCT, from a matched related donor after myeloablative conditioning, is the preferred curative treatment for patients with high-risk blood cancers. The combination of a calcineurin inhibitor and an anti-metabolite remains standard care for graft-versus-host disease, GVHD, prophylaxis in these patients. Data from 2 randomized trials have suggested that post-transplantation cyclophosphamide can reduce the risk of GVHD after SCT from a matched donor when it is added to or replaces the antimetabolite. However, the effects of post-transplantation cyclophosphamide specifically after SCT from a matched related donor remain uncertain, and effects in the context of myeloablative conditioning are unclear. Conclusions. The combination of post-transplantation cyclophosphamide and a calcineurin inhibitor led to longer GVHD-free, relapse-free survival than standard prophylaxis after transplantation from a matched related donor, with either reduced intensity or myeloablative conditioning in patients with blood cancers. Next, we will be discussing articles from Journal of American Medical Association. Hepatitis C screening in emergency departments. The Detect Hep C randomized clinical trial. Question. What is the most effective way to screen patients for hepatitis C virus, HCV, infection in emergency departments, EDS? Findings. This multi-center randomized clinical trial included 147,498 ED patient visits. Of these, 73,847 underwent non-targeted screening, resulting in 9,867 tested for HCV and 154 new diagnoses, whereas 73,651 underwent targeted HCV screening, resulting in 4,640 tested for HCV and 115 new diagnoses. Compared with targeted HCV screening, non-targeted screening was associated with significantly higher numbers of new HCV diagnoses. Relative risk, 1.34, 95% C, 1.05 to 1.70, P equals 0.02. Meaning non-targeted HCV screening was superior to targeted screening for identifying HCV infection in the ED. Next, we will be discussing articles from Annals of Internal Medicine. Vaporized nicotine products for smoking cessation among. Background. Vaporized nicotine products, VNPs, are more effective than nicotine replacement therapy, NRT, for smoking cessation in general populations, but their effectiveness among low socioeconomic groups is largely unknown. Objective. To examine whether VNPs are more effective than NRT for smoking cessation among people experiencing social disadvantage. Conclusion. Findings indicate that VNPs were more effective than NRT for smoking cessation in this population. Given the challenges for cessation among these socially disadvantaged populations, VNPs present a promising treatment option for this priority group. Next, we will be discussing articles from British Medical Journal. Global, regional, and national characteristics of the main causes of increased disease burden due to the COVID-19 pandemic. Objective. To quantify and identify the main causes of increased disease burden due to coronavirus disease 2019, COVID-19, pandemic. Conclusion. The COVID-19 pandemic significantly increased the burden of several non-COVID conditions, particularly mental health disorders, malaria in young children in the African region, and stroke and ischemic heart disease in older adults, with notable disparities across age and sex. These findings underscore the urgent need to strengthen health system resilience, enhance integrated surveillance, and adopt syndemic-informed strategies to support equitable preparedness for future public health emergencies. Next, we will be discussing articles from Lancet. Safety, tolerability, pharmacokinetics, and pharmacodynamics of the first-in-class GLP-1 and amylin receptor agonist, amycretin, a first-in-human, phase 1, double-blind, randomized, placebo-controlled trial. Background. GLP-1 receptor agonists and amylin receptor agonists have shown clinically relevant weight loss and glucose-lowering effects in people with overweight, obesity, and type 2 diabetes. Amycretin is a novel, single-molecule GLP-1 receptor and amylin receptor agonist. We aimed to investigate the safety, tolerability, pharmacokinetic properties, and pharmacodynamic effects of single ascending doses, Part A, and multiple ascending doses, Parts B and CD, of amycretin in adult participants with overweight or obesity. Interpretation. In people with overweight or obesity, amycretin appeared safe and tolerable. Results from this first-in-human, phase 1 study support further investigation of the weight loss properties of amycretin. Next, we will be discussing articles in the field of hemato-oncology. Here are the articles from Journal of Clinical Oncology. Acalabrutinib plus bendamustine rituximab in untreated mantle cell lymphoma. Purpose. The combination of the Bruton tyrosine kinase inhibitor ibrutinib with bendamustine rituximab for first-line treatment of mantle cell lymphoma, MCL, prolonged progression-free survival, PFS, but without improvement in overall survival, OS, likely because of toxicity. Acalabrutinib was shown to be efficacious and less toxic than ibrutinib in a head-to-head trial in chronic lymphocytic leukemia, and therefore might lead to better outcomes in MCL. Conclusion. The combination of acalabrutinib with bendamustine rituximab significantly improved PFS. Clinical benefit of acalabrutinib with bendamustine rituximab was achieved with manageable toxicity. Next, we will be discussing articles in the field of gastroenterology. Here are the articles from Gastroenterology. Electroacupuncture reduces duration of postoperative ileus after laparoscopic gastrectomy for gastric cancer, a multi-center randomized trial. Background and aims. Electroacupuncture, EA, may reduce the duration of postoperative ileus, POI, after laparoscopic gastrectomy for gastric cancer, although evidence is limited. We investigated the efficacy of EA in reducing POI duration and enhancing gastrointestinal (GI) recovery in patients undergoing laparoscopic surgery for gastric cancer. Conclusions. EA was superior to SA and standard care, only for reducing POI duration and the risk of prolonged POI in patients undergoing laparoscopic gastrectomy for gastric cancer. Here are the articles from Clinical Gastroenterology. Budesonide versus mesalamine in microscopic colitis, a comparative meta-analysis of randomized controlled trials. Background. Microscopic colitis, MC, is an inflammatory bowel disease of autoimmune origin that causes chronic watery diarrhea. Medications, including budesonide, mesalamine, loperamide, cholestyramine, and bismuth subsalicylate, are first-line therapies. Meanwhile, azathioprine, 6-mercaptopurine, and methotrexate are indicated for refractory MC. Objective. We aim to assess the efficacy and safety of budesonide compared with mesalamine for induction of remission in MC patients. TOTS conclusions. Budesonide was found to be better than mesalamine in MC patients in terms of clinical remission rate, especially after 8 weeks of follow-up. Budesonide also showed less incidence of adverse events. There is an urgent need for randomized, double-blinded clinical trials to provide direct and reliable evidence. Next, we will be discussing articles in the field of cardiology. Here are the articles from Circulation. Pulsed field ablation of persistent atrial fibrillation with continuous electrocardiographic monitoring follow-up. ADvantage, AF Phase 2. Background. There are sparse high-quality safety and effectiveness data for pulsed field ablation, PFA, of persistent atrial fibrillation, PER-AF, in which lesions beyond pulmonary vein isolation, PVI, are often placed. In addition, no large trials have used insertable cardiac monitors for continuous rhythm monitoring after ablation in patients with PER-AF or after PFA in any atrial fibrillation population. In Phase 2 of the Advantage AF study, a prospective single-arm open-label study of the FARAPULSE pulsed field ablation system in subjects with persistent atrial fibrillation. Patients with PER-AF underwent PFA for PVI and posterior wall ablation, PWA, and, in a subcohort, cavatricuspid isthmus ablation for typical atrial flutter. See inclusions. In Phase 2 of Advantage AF, the first multicenter PER-AF study of PFA, with continuous rhythm monitoring. 1. Cavatricuspid isthmus ablation with nitroglycerin prophylaxis was safe and effective. 2. PVI plus posterior wall ablation was safe and effective. And 3. An AA burden less than 0.1% and AA episode less than 1 hour duration were endpoints associated with the lowest healthcare use. Here are the articles from Journals of the American College of Cardiology. Impact of optical coherence tomography-based post-PCI physiology assessment to predict clinical outcomes. An Illumian 4 sub-study. Background. A novel optical coherence tomography, OCT-based physiology assessment technique, virtual flow reserve, VFR, has been demonstrated to perform as a reliable surrogate for invasive physiology conclusions. Post-PCI OCT-based VFR assessment is predictive of 2-year clinical outcomes independent of MSA. Online VFR analysis can provide operators with an immediate assessment of post-PCI physiology, in addition to OCT anatomy, providing incremental value in assessing procedural success and informing on clinical prognosis. From JAMA Cardiology. Emergency Department-based education and M-Health empowerment intervention for hypertension, the Touched randomized clinical trial. Question. Does an education and M-Health empowerment (E2) intervention delivered by a multidisciplinary team to patients identified in the emergency department (ED) with high systolic blood pressure (SBP) lead to greater reductions in SBP at 6 months? Findings. In this randomized clinical trial, among 574 patients with elevated BP enrolled from a single-center ED, those randomized to the E2 intervention had greater reduction in SBP at 6 months compared with those who received standard discharge care, meaning results suggest that an ED-based E2 intervention may be effective in improving hypertension management compared with standard discharge instructions with outpatient referral. Next, we will be discussing articles in the field of endocrinology. Here are the articles from Journal of Clinical Endocrinology and Metabolism. Clomiphene citrate medication for infertility and risk of stillbirth or neonatal death. a population-based cohort study. Objective: to assess associations between clomiphene citrate, CC, use and perinatal death. Design. Whole of population data linkage cohort. Conclusion: risk of perinatal death may be increased in pregnancies that follow use of CC. While established confounding factors related to infertility were taken into account, there may be some residual contribution of underlying. Here are the articles from Diabetes Care. Comparison of serum creatinine and cystatin C-based EEG at baseline, and their prediction of incident moderate albuminuria in individuals with type 1 diabetes. Objective: to assess the concordance between serum creatinine, SCR, and serum cystatin C, CYSC-based estimated glomerular filtration rate, EEGFR, in individuals with type 1 diabetes, T1D, at different stages of albuminuria, identify the factors associated with the discordance, and study the association of CYSC, EGFR of creatinine, EGFR-SIR, and EGFR of cystatin C, EGFR-Cs as cystatin C, EGFR-Cs, with incident moderate albuminuria. See conclusions. These findings suggest CYSC may facilitate early identification of individuals at risk for albuminuria. Next we will be discussing articles in the field of neurology. Here are the articles from Neurology. Lamotrigine and cardiac arrhythmias, a target trial approach. Background and objectives. While lamotrigine is an effective, well-tolerated anti-seizure medication, ASM, a recent warning raised the possibility of ventricular arrhythmias. We compared arrhythmia incidence between patients newly treated for seizures with lamotrigine and those with levetiracetam, presumed cardiac inert. Next we will be discussing articles in the field of pulmonary and critical care. Here are the articles from Chest. Modified cuff leak test for predicting the risk of reintubation in patients with invasive mechanical ventilation. Background. The cuff leak test, CLT, is an important tool to assess the risk of upper airway obstruction after extubation. Research question. Does a modified CLT approach have superior ability in predicting reintubation compared with the traditional method? Interpretation. Compared with the control group, the modified CLT approach might better predict PES within 24 hours of extubation, especially for patients with IMV duration longer than 6 days, but it was not shown to decrease the reintubation incidence and mortality. Here are the articles from the American Journal of Respiratory and Critical Care Medicine. Airway scaffolds for emphysema-related hyperinflation. 6-month results from the BREATHE trial. Rationale: despite advancements in emphysema treatment, high morbidity and mortality rates highlight the need for innovative therapies. A novel self-expanding nitinol airway scaffold was designed to alleviate lung hyperinflation by connecting emphysematous parenchyma with central bronchi, releasing trapped air. Objectives: to assess the feasibility, safety, and initial outcomes of airway scaffolds in treating emphysema-related hyperinflation. Conclusions: this study provides the first clinical evidence of the feasibility, safety, and initial outcomes after treatment with airway scaffolds in patients with emphysema-related hyperinflation. Next we will be discussing articles in the field of nephrology. Here are the articles from Clinical Journal of American Society of Nephrology. The Emerging Nephrology Physician Workforce in the United States, Defining an Impending Shortfall. Key points. Consistent growth in the number of nephrology fellowship programs and fellowship positions along with a consistent decline in the number of applicants. Approximately 1/3 of available nephrology fellowship training positions went unmatched. The results from this study suggest that the bottleneck to increasing the future nephrologist workforce exists in recruiting interested applicants. Here are the articles from Kidney International Reports. Point-of-care testing and integrated digital health technology for CKD screening in high-risk populations of India. Introduction. Chronic kidney disease, CKD, is a significant contributor to morbidity, mortality, and healthcare expenditure. Lack of early diagnosis with treatment leads to progression to advanced stages requiring high-cost interventions. The current pilot study examined the feasibility of using point-of-care testing, POCT, and digital health technology for CKD screening. Conclusion: CKD screening using POCT and digital health technology allowed diagnosis of CKD in patients of high-risk groups, and should be scaled up with the final goal to ensure early diagnosis, decrease costs, and improve patients' clinical management.
Thank you for listening to This Week in Medicine, your filtered medical journal summary. Have a great week ahead, stay blessed and be humane.